Welcome to another Journal Club session. I hope you enjoyed last month's topic that looked at perceived utilization of leadership styles among nurses. If you have missed it, don't worry. You can always access it through the YouTube channel. Are you watching this alone, or have you gathered a group of colleagues to watch it with you? If you are alone today, maybe consider watching with colleagues next time. You can access a guide how to organize colleagues watching together in the description section below. This month's article is about the knowledge, attitudes and practices of doctors, pharmacists and nurses on antimicrobials, antimicrobial resistance and antimicrobial stewardship in South Africa. It was written by Balaram et al. And published in the South African Journal of Infectious Diseases in 2021. Let's first look at the graphic summary of the article. This graphic breaks down the different sections of the article and provides a visual summary. In this video, we will now unpack each section. If you have a copy of the article with you, you could track the sections of the article as I speak. We start with the introduction that you can find on the first page of the article. Incorrect use of antimicrobials has contributed to the development of antimicrobial resistance. Incorrect use of antimicrobials refer to prescribing antibiotics when it's not indicated, incorrect dosing and administration, and non-compliance. Approximately 700,000 people die of resistant antibiotic infections every year. The Global Action Plan to address antimicrobial resistance focuses on 5 strategic objectives. The strategic objective 1 is increased awareness of antimicrobial resistance through communication, education, and training. Healthcare profession education on antimicrobial prescribing needs to start at undergraduate level and continue at postgraduate level with specific training in using treatment guidelines. Legislation in South Africa now allows nurses, pharmacists and emergency care personnel to prescribe antimicrobials under certain conditions. All healthcare professionals should be knowledgeable and up to date on antimicrobial issues. The study aim was to ascertain the knowledge, attitudes and practices, sometimes known as CAP, of doctors, pharmacists and nurses in order to identify gaps for education intervention. We now move on to the methods section of the article, where the authors explain how they gathered their data. You can find this on the second page of the article, right after the introduction. The study was a national, descriptive, cross-sectional online survey. Questionnaires were sent to pharmacists, doctors and nurses, both registered and enrolled. The study was undertaken from November 2017 to January 2018. Data were collected using a self-administered, web-based questionnaire with voluntary informed consent. The questionnaire was developed and piloted from several pre-existing questionnaires, and responses were anonymous. The questionnaire consisted of open-ended questions, or free writing, closed-ended questions, yes or no, and Likert-style questions. Answers ranked from strongly agree to strongly disagree. The questionnaire was divided into 4 parts, which included demographic, academic, and professional data, knowledge on antimicrobials, antimicrobial resistance, and antimicrobial stewardship, attitudes and beliefs on antimicrobials, and lastly, practice-related questions asking about issues related to prescribing, guidelines, and advice given to patients. To note that knowledge, attitudes, and practices are referred to as CAP in the article. Moving on to the analysis and results, which starts on the second page of the article. Results from the questionnaire were analyzed using a computer software program called SPSS. The second column on page 2 of the article, under statistical analysis, explains what tests were used to analyze the data. In summary, statistical tests called student t-test and Wilcoxon test were used to compare continuous variables, for example age. Tests called chi-square and Fisher-exact test were used to compare categories, and the analysis of variance, or ANOVA, was used to compare the knowledge, attitudes and practice scores between pharmacists, doctors and nurses. Note statistical terms can be intimidating. Researchers that use statistics in research will always consult a statistician. It's important not to be intimidated by statistics because it can stop you from reading a research article that has statistical terms. Rather look up each test that you come across to understand the basics about what the tests are used for. By doing this, you will slowly improve your knowledge and feel less intimidated. So let's look at the results. A total of 2,523 questionnaires were returned, of which 1,120 were doctors, 744 pharmacists, and 659 nurses. The first paragraph on page 3 of this article provides more detail of the participants' demographics. The summary highlights the results that are most relevant to nurses. We'll start with knowledge. 93% of healthcare professionals perceived antimicrobial resistance to be a serious global problem. Nurses were the least aware. Less healthcare professionals, or 73%, thought that it was a problem in their hospital or practice. Figure 1 on page 3 of the article depicts the nurses, pharmacists, and doctors' levels of knowledge in percentage regarding antimicrobials, antimicrobial resistance, and antimicrobial stewardship. Knowledge scores between doctors and pharmacists didn't differ, but nurses' knowledge was significantly lower. Contributing factors towards antimicrobial resistance identified by healthcare professionals were overprescription at 91%, patient pressure at 75%, and non-adherence at 73%. Table 2 details the percentage of doctors, pharmacists, and nurses who were confident versus unconfident in various aspects of prescribing antimicrobials. 49% nurses were confident in 6 out of 10 aspects of prescribing. 94% healthcare professionals agreed that there were risks associated with irrational use of antimicrobials, 82% being antimicrobial resistance, 32% side effects, and 23% adverse reactions. 81% of healthcare professionals requested more education and training on antimicrobial use, antimicrobial resistance, and antimicrobial stewardship. Doctors had significantly more knowledge of antimicrobials, antimicrobial resistance, and antimicrobial stewardship than pharmacists and nurses. Looking at the results for attitudes. Most healthcare professionals, or more than 60%, disagreed that antimicrobials are safe drugs. 96% agreed that prescribing antimicrobials unnecessarily would negatively affect the patient's health. Healthcare professionals believe that education, 91%, use of therapeutic guidelines, 85%, and improved infection control at 66% would help combat antimicrobial resistance. For practices, only 16% of nurses reported prescribing antibiotics empirically. This means when an infection is only suspected and remains unconfirmed. For doctors, this was 80%. Interestingly though, only 23% of nurses sent samples for microbiology testing before initiating antimicrobials, in comparison to 52% of doctors. Fewer nurses than doctors reported having the latest South African standard treatment guidelines, and only 18% of nurses reported always using them. Statistically more nurses at 83% than pharmacists, 81%, and doctors, 75%, gave correct advice on the safe use of antimicrobials to patients. When looking at practice scores, nurses scored 54%, where 0% represents poor practice and 100% best practice. Appropriate treatment was provided by 35% nurses, and only 2% nurses provided the correct strength, interval, and duration. Which brings us to the conclusion. Antimicrobial resistance is an increasingly public health threat. Awareness of antimicrobial resistance is the first step in addressing and reducing the global problem. Nurses were least aware of antimicrobial resistance. All healthcare professionals, however, reported low levels of awareness of antimicrobial resistance in their own workplace. Only 16% of healthcare professionals were 100% confident in their knowledge, where 40% had received training but 80% reported that they needed more. Attitude scores were highest in all healthcare professionals and practice scores were the lowest. So what is the implications for practice and policy? The authors acknowledge the existing gap in knowledge, attitudes and practice, and therefore recommend that pre-service and in-service education and training needs to be reviewed to include education and training on antimicrobial resistance. Higher education institutions for healthcare professionals and the professional bodies that regulate this education should map and update existing curriculum using the World Health Organization's competency framework and curriculum on antimicrobial resistance. We've come to the end of the video, and so now you need to access the article. The link is in the description box below, or maybe you have already printed a copy. We really encourage you to read the article in full, recognizing the parts that we have just summarized for you. After you've done that, consider the reflective questions here on this slide. If you are watching with colleagues, discuss your answers between you. Following that, take a moment to think about what you have learned and how you could apply it to improve nursing practice in your setting.